Hey YouTube, it's Marita and welcome to another edition of The Nurse Lounge. In this edition, we're going to talk about my very first year as a new grad novice nurse. So it is story time. If you would like to hear more about other stories that I have in nursing and my experiences, please hit the like button so I know that you do want to see more videos like this. But until then, let's jump right in. So my first year, before we go there, I want to kind of give you a backstory. I was 26 years old when I finished nursing school, and I already had a job lined up prior to graduation. So my job already was at this one hospital, and it was for OB, which is what I wanted. I wanted to be an OB nurse, and luckily for me, back in that time period, you could not get jobs in specialty areas fresh out of out of nursing school. You had to already have experience most places. But luckily, that was a time of transition, and so there were different facilities that were willing to train new grads into specialty areas. So no, I did not go to med-surg first. Matter of fact, I've only been in med-surg for 3 weeks, and I hated it, and so I quit. And that's after the first year. But the first year, I already had a job, so I graduated. I started my job on June 7th in 2004. So keep in mind that's 2004 and we're in 2019 now, so that's been 14 years ago, going on 15 years when June comes this year. Today is January the 11th. So with that being said, I went on my first day June 7th. And at this point in time, I had not taken my boards yet. So I went and took my boards in July. But I worked as a graduate nurse where I was just being trained about what my job was going to be, shadowing another nurse, my preceptor, for her to teach me everything I needed to know regarding how to do my job. I stayed on day shift for 4 months, I want to say, and then went to nights for 1 month, or maybe it was 3 months days and 1 month nights before I was fully on my own off of orientation. So going back, I feel like I was very much prepared from the clinical aspect. I knew my job as a nurse. I caught on really quick to what their roles were, what they had to do there, how they did their nursing. I caught on to that. But what I was truly not prepared for was the nurses eating their young phenomena. When I tell you that is true, it is true. And most people will tell you that, oh, nurses eat their young. It's always the older nurses. Not always. Sometimes it's the younger nurses or the ones who are young but more experienced than you. I have a young face, and so being that I look younger than I actually am, I'm actually 40 now, and people think I'm in my late 20s to early 30s. So it is a compliment, but imagine at 26 when I started nursing what I looked like. So sometimes people think because you look young, that means that you can be ran over and, things like that and talked to any kind of way. And that's exactly how I was being treated by all of my new coworkers. And so I started in June, like I said, and I started off making RN pay, even though I was a new graduate without my license yet. So the way this hospital worked was you got paid your RN pay, but if you did not pass your boards the first time successfully, then they would dock you down to tech pay. So by the way, I don't recommend you buying anything until you have, if your hospital does the same thing, do not buy anything until you have actually passed your boards before you start making large purchases like cars and houses and things like that, because there was a nurse who I worked with who did do that, and she failed her boards and she could no longer afford her new townhouse and her nice new car at that time period. So make sure you hold off on that. All right. So anyway, I had this job and I had worked it and I thought everything was going well, and it would just go from one thing to another where people were treating me so poorly. So an example was, there was this IV that was beeping, IV pump that was beeping. And I went to go try to fix it for a nurse because I have always been a team player. Even back then we were taught to be a team player. You helped your peers, you helped your coworkers. If they needed help, you helped them. Hopefully they would do the same for you, which is not true in that situation. So I went to go help clear her pump or fix whatever was beeping. And she said to me, "Don't you ever touch my pumps." So I said, okay, you know, not knowing what that was about. So I didn't touch it. It just kept beeping. So I generalized that they didn't want me touching any of their pumps. So the next time, it was another shift, a pump was beeping. I went to the nurse and I said, "I just want to let you know that your pump is beeping." She said, "Okay, so what school did you go to? Do you not know how to fix a pump? You know, I can't believe you're here and you can't even fix a pump." She said, "What's going on with this day and age of nurses?" And again, this is in 2004. So now I'm confused because one nurse is telling me to not touch her pumps. And then another nurse is telling me, you know, go ahead and fix it. If you know how to fix it, fix it. So I'm distraught. And I'm, you know, at this point, I'm kind of like, okay, I don't know what to do. I don't know. Everybody's treating me this kind of way, that kind of way. And then not to mention, I had to bring this up, but being a minority in a unit in OB, which is predominantly Caucasian, it's very difficult because people still mistreat you. So we deal with racism and things like that. That's not what this video is really about, but I'll make another video on that. But that did happen a lot during that first year where I experienced a lot of racist type issues, remarks, even from patients and my coworkers alike. And it was very, very difficult. So as time went on, I realized that they kept on picking on me and picking on me and picking on me. And I just simply decided that, you know what? I'm no longer going to let people continue to treat me like this. And at that point in time, I said, I'm not going to cry anymore. I spent that whole first year crying. Either I would go to a closet or I would go to my car when I got off my shift, and I would just cry and cry and cry and cry. And much like a bad relationship, after a while you get tired of crying. So I just decided, you know what? I ain't crying no more. I'm going to tell these people that they're not going to treat me like this. So of course, you know, the next shift, something's going to happen. So the next shift, let's go about 5 months into it now, I'm on nights and I'm being trained by a night shift nurse. And we had a interracial couple. And so she was Caucasian and he was black. And he had been flirtatious with all the staff the whole night. And so the girlfriend who had just had a baby had noticed that he was very flirtatious, and she wasn't liking it. So she told the nursery nurse to tell my preceptor that she didn't like me, but she didn't know why. And so that nurse comes and tells my preceptor and me as well that, you know, that patient said that she didn't like her and she doesn't know why. My preceptor said, "You need to go and apologize to them right now." I looked at that preceptor and I said, "No, I'm not going to. The reason why she's acting like that is because her boyfriend, the father of the baby, is flirting with everyone." I said, "That's not my problem. That's between him and her. He has an issue with being flirtatious and she has an issue with him and she's taking it out on me. I have nothing to do with that. I'm not going to apologize for anything." So then she says, "Oh, okay, well, I didn't know that was going on." I said, "Well, that's exactly what's going on, and I'm not going to apologize for something that I did not do." And so then she was just like, "Well, that's fine." So the remainder of the night, you know, it was kind of awkward, shall I say, because I didn't apologize and I wasn't going to do anything about it. That's not my problem. That was his. But then a few nights later, I had another patient who she went into a diabetic coma, but I didn't know it because I didn't know what diabetic coma was. Of course, you know, in nursing school, you're not taught, or you don't see everything in clinical. We learn it as we go. So I had a patient that for some reason, I can't get her to wake up when it's time to do her vital signs. And I start noticing some of those signs or symptoms of being clammy and lethargic and just kind of laying out there. And then eventually it clicked for me, take her blood sugar. So I took her blood sugar, and I remember it was 26. And I'm like, oh my gosh, 26, she gonna die. That's what I thought, she gonna die. So I'm up here running frantically, which you don't run out the patient's room, but I was running frantically and I was like, oh my gosh, she's gonna die, I need help. So luckily that particular night, there was nurses there to help me. But I was on my own at this point. So in terms of, I didn't have a preceptor anymore. I was on my own. And the way they did their staffing was you had one nurse per 6 patients and you worked by yourself. And so therefore, oftentimes at night, I worked by myself on my side of the unit, which was the postpartum GYN side. And then the L&D nurses worked on the other side of the unit, and they would have 2 or 3 nurses over there. So if I needed somebody, I would have to go to L&D to get someone. Luckily, this patient's room was kind of in the middle between both sides. So they heard me calling and they came. And they helped me get IV started and things like that. And I called the doctor and we got her back and she was fine after the fact. But, you know, I had teamwork that day. But then don't you know, they turned around the next day and called or told the nurse manager that I was not helping the patient at all, that I didn't take care of her and she had all these issues, which was a complete lie. They looked at my documentation, they looked at everything that I did, and my documentation was stellar, and I had followed protocol, the hypoglycemic protocol, so there was nothing that could be said about me. But again, this just shows you how people will try to go set you up because you're different. It could be because you are pretty. It could be because you happen to have a different color skin as some of your coworkers, but this is the reality of my nursing journey. And going forward, we had a situation where a LPN who was much older than I was not happy that she had to take order, I don't want to say take orders from, but was not happy that she had to work with someone who obviously had less experience, which that was me, but had a higher credentials in terms of being a registered nurse, and she was an LPN. So she thought, and she was an L&D nurse at that. So she thought she would call me, report, and say, I'm going to bring a patient over. And I said no, because I just got an admission. Now, mind you, like I said before, it's 1-to-6 ratio and there's no nurses to help you. So I had literally just got an admission. She said, oh, okay, well, I won't bring the patient over. I'll just wait till you're done and you can call me back. So I said, okay, that's fine. Well, fast forward, I'm hearing the call light go off steadily, just steadily, and no one is there to answer it. Why? Because I'm the only nurse working on that side, and I was in that other patient's room taking care of her. So after that had happened, I finally get done with her and I go answer the call light, and this patient says, this is the patient in room such and such, which I didn't have a patient in that room, and I've been waiting here for 25 minutes and no one has come checked on me. So don't you know that nurse went ahead and brought that patient over anyway, and she never gave me a report? And so with that being said, you know, that's not safe. For one, you don't take a patient without getting a report on them. And because no one had knew that she was over there besides the nurse who brought her, don't you know they wanted to try to get me in trouble by saying, well, you know, the patient said, well, the nurse never came and saw me. First of all, I was the only nurse over there, so I couldn't see her while I was seeing another patient that I had just admitted. And then number 2, that nurse had no business bringing that patient over there. She was trying to set me up. So yet again, the next morning, guess who gets a report to the nurse manager? Me. So the nurse manager's like, well, you know what? We need to kind of evaluate what's going on with you. Are you okay? Do you feel like this is a good area for you to be working in? What's going on with you at home? Just asking all these questions that I felt like were really not even relevant to what's going on. And again, I am the only minority on this floor. And it's beginning to get obvious, well, at night anyway, it's beginning to get obvious that they're having issues with me and I did nothing wrong. So believe you me, when nurses eat their young, and that good old boy system, they're very cliquish in nursing. Nurses are very cliquish. It happens to even the best of us. So it was very troubling. I got out of that situation. Everything was, nothing was documented. She admitted, the nurse admitted that she did that to me, and she got wrote up for it. Then, so anyway, my whole point in all this is, story after story after story went pretty much just like that, where every time you look around, I was getting in trouble for something that I didn't even do, or something that I was never taught. So my first year was, for the lack of better terms, traumatic in some ways. I don't think I've ever cried about anything as much as I did that first year of nursing. And Honestly, that's the reason why I became a nurse educator, is because I wanted to make sure that students were well prepared as best as they could be for what the real world of nursing is when they come out of school. So I've kind of set my mission to make sure that you're prepared to know how to handle these situations when people are treating you any kind of way, when your whole objective as a new nurse is just to learn and be kind to everyone. We want to learn and we want to help, help people who are sick, and we want to learn how to do our jobs and do it the best that we can. And when you have preceptors who don't want to precept, which I had that, you don't learn. You just don't learn. They don't care if you learn. They don't care. Now, this is not all preceptors, so don't come after me saying, well, I was a preceptor, and I'm not talking about you. I'm talking about the ones who truly are forced to be preceptors because you're the only one who can do it with seniority or whatever the criteria it is for you to be a preceptor. And you're put in situations in which you don't want to be in. You don't want to precept because it takes time and effort and it slows you down and things like that. But I will have to say, it was so bad that I started having physical symptoms when it was time to go to work. So what does that mean? Physical symptoms mean I would be fine all of a sudden, and then the day before it's time to go to work, my next shift, I would always have either stomach pains or headaches or nausea even. And that was my body's way of telling me, you're not feeling this anymore. You are stressing or have anxiety because of this job. And I began to realize that if this job is causing me this much stress and this many problems, then maybe this is not the job for me. But at the same time, I had 2 little girls that I had to take care of, and I was a single parent. So I had no choice but to stay there. So that is the hardest thing to do, to have to stay somewhere where you are treated bad, but you have to have the money, and you can't go back to the way life was before because you was making minimum wage back then, and now at least you're making 2 or 3 times minimum wage, and you can actually take care of your kids. So it's like, what do you do in that situation? And so luckily I had found one friend who she would kind of get me through my shifts, or 2 friends actually, who would try to get me through my shifts and try to talk to the other nurses who were friends with her to say, stop treating her like that. You're going to run her away and things like that. Well, as time went on, I started again June 7th of 2004. June 6th of 2005 was my last shift, because I put in my notice at that point. Everybody had told me, if you can last 1 year and get your experience, and then you move on. And so it was so bad, I called in on my last shift. That's how bad it was. And that was June 6th of 2005. I just said, I can't deal with this anymore. It was literally making me sick. I had started losing hair. I had, I had started having, like I said, headaches and just stomach issues, things that I didn't even have prior to having this job. So I knew that this job was the culprit. So again, my first year was very, very bad. However, I did learn a lot that year. And what I learned, what I'm talking about learning, it's not about the skills or even the nursing aspect, really. It's more about how people treat you and what you accept is what people do. So people will only treat you how you allow them to treat you. And I learned that after that first year of enduring all that. So that was my lesson. So I'm kind of like, okay, now I have the mentality or attitude where you will not disrespect me. That's what I had to get out of that first year. You will not disrespect me. We do not have to be friends, but you will respect me because we are coworkers and we're here to take care of that patient. So if I need you to help me take care of a patient, then that's what I expect for you to do. We don't have to go out this weekend. That's not what I'm asking for. I'm asking for us to work together to take care of our patients and make sure that their needs are taken care of. And at the end of the day, that's all I ask for. And I think that first year really taught me about people skills, customer service, how to deal with problem situations and problem people, even how to deal with management, someone who is over you. You really want this job and you really need this job, but at the same time, you don't want to kiss anybody's tail, which I don't do anyway. I'm very appreciative of that nurse manager for giving me the chance to learn how to do OB care, but at the same time, it was a horrible experience when it comes to how I was treated by my nurses, my fellow nurses. And I will never forget that. Again, I've been a nurse now for 14 years, and I will never forget that. That is one of many stories. That first year is one of many years in which I have had bad experiences in nursing. However, I still love what I do overall. I can't change people who are like that. The only thing I can do is either typically ignore them, or if they come at me crazy, I'm gonna have to say something. But other than that, I just don't bother those kinds of people. And to be honest with you, fast forwarding to the last, say, even 5 to 10 years, I've had many situations with people in which they've come at me incorrect. And once I corrected that situation, we have been cool ever since. So some people want to know how far they can take you. And this is doctors included. There's doctors who their ego is so high strung that, you know, they're going to talk to you any kind of way. I am not the one, and they have learned that I'm not the one. And I can be respectful towards them, and they can be respectful towards me, and we don't really care for each other, but we can still get our jobs done. And at the end of the day, that's all that matters. So I hope this story has been enlightening, only in the sense of to know that this is normal. This happened 15 years ago or 14 years ago for me. I'm sure it happened to nurses who finished school 20 years ago, and it will continue to go on. But just know nurses do eat their young. And we have to create an environment that's much better than what I endured, so that people are no longer having to deal with being bullied in nursing, but at the same time, learning what their job and their role is, so they can be a more proficient nurse and not have to deal with the antics of high school stuff. That's exactly what it is. It's a bunch of women, because you know nursing is female dominated, but it's a bunch of women who are cliquish, and it's this bullying match. And we're gonna make sure that the new person gets, you know, gets treated a certain kind of way if we don't like him or her. It happens to males too, but if we don't like him or her, you know, we have to know how to handle that. So again, I hope you've enjoyed this video. If you are new, please subscribe. If you are old, welcome back, and thank you for your continued support. If you want to know when I upload a video, please hit that notification bell down there in the corner. But until the next time, take care. Bye-bye.